Hi, everyone, and welcome to the special simulcast of the Neil Haley Show and the Reset Medical and Wellness Podcast. I'm the presenter, Neil Haley. I have with us today, who always comes on the show, Dr. Louwers, and he brought a special guest. Dr. Louwers, how are you?
I'm great, Neil. Thank you for the introduction. Yeah, a very special guest today. I'm very excited to introduce Dot. She's a physician assistant, and she recently started concierge functional medicine, which is really interesting and neat. And I love what she's doing because it's um, it's really bringing together some of my most passionate things, which is um, root cause treatment and and patient advocacy and patient-centered treatment. And she's brought that together wonderfully. So thank you, Dot, for coming on. And first question, just tell me a little bit about yourself and your new business. Tell me about it. What are you doing? How is it so unique? Which I know it is.
Guys, thank you so much for having me. I'm so excited and honored to be a guest, truly. I have been a PA for over a decade now, which is kind of crazy to even believe. But I recently opened a concierge style functional medicine practice in the Northeast Ohio area. Functional medicine is very near and dear to my heart, especially being in the, I guess, more modern medicine pathway for quite some time. My background is in emergency medicine and trauma surgery. So I've seen people at like their worst, on their worst days, continually over and over again. And through my own personal journey, I've just discovered that functional medicine is actually more, I don't want to say more therapeutic, but it gets to people's root causes and it really meets people obviously way before those emergent situations. But rather than putting what could feel like a band-aid on a situation, we're getting to the root cause and looking at the whole body through the whole system. So it's been really amazing. It's been a wonderful journey, and the community has welcomed me greatly. So I'm very fortunate.
And that's amazing. And thank you for what you do. But
Yeah.
this isn't just any concierge functional medicine. I mean, you really go above and beyond. And I want you to tell me about because it's seriously, it's very unique, and I love it. And you go to patients' homes. I mean, tell me about that interaction because that's something that we haven't seen in healthcare in a long time.
Yeah, I kind of advertise myself as like a pocket PA, if you would. So often we hear of people who prepare for that 7-minute visit with their clinician that they get every 3 months, right? And oftentimes they leave and they have more questions leaving than they go in with, and it's frustrating. And so I'm bringing old school back. I actually go to people's homes. I feel like I meet you where you're at. I come to your home. It tells a lot about you. It tells a lot about your home, your situation. It tells you things that you might not otherwise admit to or say to a medical provider, right? What does your home look like? Is it chaotic? Is it busy? Is it stressful? These are things that add into your health history and your life, right? So I styled my I in a world of so much telehealth, I'm doing the opposite, right?
Yeah.
I'm coming to people's homes, and not every visit has to be in home, but definitely those first ones where I'm getting to know you, and that way I can give you the appropriate care. We can say all the right things, but unless we actually get to the foundations of your life, we might not get anywhere, really.
Right. And see,
So
that's the
true.
amazing thing, Dr. Louwers, that I'm blown away is that as a busy professional myself, going to the doctor is a tough thing. And to have a functional medicine provider to come to the house to
Yeah.
Yeah.
do all the different things that are necessary, that are needed, it's just unreal because of
Yeah.
busyness and different things, and really having certain goals and set for yourself that, you know what, I want to kind of really talk with you, have conversations. I've had doctors where I've gone and printed out this huge thing from AI. This is exactly the things I'm trying to work on and improve. They stay
Yeah.
2 minutes, say, oh, that's it. Sorry, no deal.
Yeah.
And it's like, are you kidding me? I put this time in. I've looked at my health. These are the areas I need to improve on. Well, I'll get you this specialist, this specialist, this specialist. Explain how that kind of gets lost in having a relationship with that patient, see that patient's growth.
Yeah, it does. It definitely does. And with that comes, other emotions, right? You're not going to be on your best game able to express yourself efficiently if you're rushed, hurried, stressed. Oftentimes, when I'm working in the hospital still, I recommend bring your spouse, bring a partner, someone else as a listening ear who can actually sit there and I'm like I'll lay it out there. I'm not replacing your primary care. I'm not replacing your healthcare team. I'm here to help you get to that root cause if you're frustrated or you're hitting that wall. But also with that comes, like advocacy, like Dr. Louwers was saying, but also meeting people where they're at and making sure that they understand. Because oftentimes too, right? You go in, you're flustered and you don't actually understand what's happening, and you're too ashamed or embarrassed to even ask those questions. And that's why, I mean, I kind of created a system around what I felt was needed for and necessary is people who don't have time and they're frustrated with their care. And that's where I built my system around is and this
Yeah.
is
And
sorry, go ahead.
oh, I would say I know as a healthcare provider, just in general, when and you do a lot of education, obviously,
Yeah.
that's core to what you do, as do I. And when you're doing that education component and you're trying to also at the same time explain diagnosis and treatment and maybe consent and what we're doing today. And that, like you said, it very easily gets lost. And it's so nice when someone has that comfort of their own home, right? I
Mhm.
think um, all too often I talk to a patient for an hour, which is great. Again, that's missing in healthcare. But also, if, gosh, they're in their home and their family's there with them and it's comfortable, I think they're going to get that message just so much better. And that education component, I think, really shines through. How have your patients respond? I assume positively, right? But like in general, what's the feedback that you've been getting from this? Because it is unique.
Amazing feedback. I'm honestly shocked. I'm one of my more recent clients, he's a doll. And I kind of, it's interesting because I geared my practice towards women and moms and kids because those are busy, right? They're the busy clientele that I think of. But this gentleman came to me and he's so sweet. And he actually came to me because he is so turned off by the healthcare system. He has just not sought care. And refuses it, avoids it. It gives him that flush sense of like I don't want anything to do with this. And he called me and he said, this takes a lot for me to even make this phone call. And he said, I feel comfortable with you because you are a PA, and I'd like to start somewhere. And so I said, I'll meet you where you're at. I'm not going to do anything you don't want to do. This is a relationship. This is an investment from both of us, right? Because like we know now, it's more the doctor telling us or the provider telling us versus
Yeah.
what does this relationship look like. And so I work very hard and we have a great rapport now to have that trust, to rebuild that trust that he is able to establish care with me. But more so, if he does have to go to the another specialist or a primary care for that reason, he has this trust that he's able to advocate and speak up for himself and create this relationship and this building this healthy trust system with his relationship with medicine in general and his body too, right?
Yeah, and so many people have given up on medicine,
Yeah.
right? Which is really unfortunate. It's what I see in my clinic every day is that, patients are coming in saying, "Oh, I tried that. I went to therapy. I did the medications." I'm like, "Well, let's take a different approach."
Mm-hmm.
Right?
Mm-hmm.
And I think when patients hear that and recognize that, you're not just a number, it's not the typical treatment, the typical spiel, the 7-minute doctor approach.
Yeah.
I
Yeah.
think they start to open up and you can really get to some really, quality change. Shifting gears just a little bit.
Yeah.
So, one of the things that we have in common, obviously, I'm treating mental health, and
Mm-hmm.
that very much coincides with what you do.
Mm-hmm.
I know, they say something like 80% of our serotonin is produced in our gut, and
Yeah.
there's this intense mind-body connection, which of
Mm-hmm.
course you and I both know there is. But can you, for, the listeners, just sort of explain that a little bit, why it's so important that that we're addressing our gut health, our nutrition, our physical health, and how that impacts our mental health?
Yeah, that's huge, right? I've heard several different things, right? We've heard serotonin is found in the gut. We've heard gut brain axis, right? That communication between the two. We've heard all those things. And it is all connected. And I think that's where medicine now has kind of lost its footing, is that instead of these small little ecosystems, it's all one functioning system together, right? I'm not a I'm not a car person, but when you look at a car and you go to fix the car, you don't just look at one part of the car, you look at the whole car, right? You're making sure that there isn't a backup somewhere else. And so part of that is all inclusive, right? You're looking at everything all together. So you know, what are the things, and how do you diagnose depression, right? You look at what's happening in their life. Why aren't other processes or illnesses also looked at what's happening in your life, right? It's all like that. So it's all connected. It all goes to a much deeper level. I'm not saying, have a healthy diet, you fix your depression, right? That's not what we're saying at all. But it's
No, but
definitely
it has an impact
a
on it.
huge impact, a
Right.
huge
That's
impact. Yeah.
that's the idea. These things are very much linked. And even
Yes.
though it may not be the only driver, right?
Yes.
It
Yeah.
is a driver,
Yes.
right? You can't address your nutrition or your cardiovascular health or your sleep or your mental health independently because they're
Right.
all very much linked, right?
Right.
If you're
Right.
stressed, if you're anxious, your blood pressure goes up. Your
Hmm.
gut starts to reduce its absorption of nutrients.
Yeah.
You're not sleeping as well because you're stressed. And guess
Yeah.
what? Then your mood's crappy and
Yeah.
you just feel like junk and you get headaches,
Yes.
chronic
Yeah.
pain, and it's all very much intertwined. And it's unfortunate that in healthcare today, that's not prioritized as much. Like
Hmm.
you said, it's all these like individual doctors, providers,
Hmm.
nurses, healthcare workers, they're all doing their own thing and they have this tunnel vision and
Yeah.
they're so specialized in their one square centimeter of space, the
Hmm.
ENT doctor that only addresses one of the three bones in our inner ear is his
Right.
specialty,
Right.
right? And they're missing so much of the bigger picture.
Yeah. Yeah.
When it comes to your typical patient with anxiety and maybe
Mhm.
some trauma history, what is it that you see that, is clear in perhaps their presentation, their workup, their diagnosis, their physical findings that indicates like, okay, there's this link, here's this connection. They have anxiety, that makes sense because this is what I'm finding, or vice versa.
Yeah, how it's connected with the gut.
Yeah,
Yeah, yeah. It's interesting because you also can take five different people with anxiety and depression or depression, and you get five different clinical scenarios, right? So that's what makes this so tailored and specific. But more often than not, those people, I'm looking and doing a deep, thorough analysis of what does their day-to-day look like, what does their sleep routine look like, exactly how you just touched on, what
right,
does their nutrition, their movement, right? Movement has a huge link with that reduction of depression, right? Even just 10 minutes a day has a huge link with that. So
right.
it's looking at the whole picture. And going back to the gut, more often than not, it's doing like those fancy gut stool tests, right? Because it's all
Okay.
it's all connected. But it's looking at the whole picture and making it specific to that unique individual for sure.
And so
Wow.
wait, what exactly is a fancy gut school stool test for for our listeners? Can you explain a
Yeah,
fancy
yeah.
stool test?
So of
Not a
course.
regular stool test. I want to hear the fancy one,
Yeah,
right?
it's interesting you say that, actually not a regular one, because more often some of my patients that are coming to me, they're saying, "Oh, my doctor ran a stool test, I'm fine." I said, "No, I know what
Right.
they ran. They ran
Yeah,
for C. diff. They looked for that infection. I'm looking at your gut lining. I'm looking at how your pancreas, the enzyme is actually breaking down that food. Is there a, like, it's like a chain. Is there a block in that chain up ahead? Is it an upstream issue? Is it a downstream issue? Like, where is the problem, right?"
right,
So these stool tests that I'm running are much more involved. They look at the inflammation, the lining of the gut, because if you have what's called leaky gut, that's not going to be a nice tube, right? And you're going to have more problems with absorption, digestion, breaking down those things. You might have issues with micronutrients, vitamins, magnesium, folate, those things. That will all come through and show us in these stool tests. And that's way like a much more thorough than what they're doing at the doctor's office.
For sure. No, that makes a lot of sense, Dot. And how sort of do you see, I mean, I can tell you how I see it, and I know we've discussed this before, but how do you see um, a teamwork approach
Hmm.
to what you and I both do? Like, what
Yeah,
is, your typical patients coming in, they're looking at it as two totally different issues,
yeah,
right? How do we
yeah.
bring that together? How do we say, okay, this is very much linked. And in what order? Like, are they, because I get this question a lot. Do I go and see Dot now? Do I want to talk to functional medicine now, or do I wait till this or when? Like, what's the algorithm and what are you telling patients? And it might have a different answer than I do. I don't know, but I'm curious.
I'd be curious to hear what you think. I think it's not a black and white because it's such a cohesive relationship, right? And that's where I think we mesh really well together because you're looking at things, well, you obviously can say it way better than I can, but you're looking at things through this vagus nerve, right? This whole system. And we're linking it all together with all the other pieces of the puzzle. We're just bringing it all together in this nice, beautiful picture because it creates that whole system. And so it's this relationship, this really healthy balance of all of it connected together. So it's not like a you or me or you before me like that. It's a with situation, you know. It would be a cohesive, or it is a cohesive go with and in communication with process.
Yeah,
And something that goes back and forth.
I'm going to take your answer because that was a good answer. Yeah, no, absolutely. That's 100%. I agree. It's individualized,
Yeah.
of course, right? Number
Hmm.
one, like every
Hmm.
patient, maybe someone doesn't know about functional medicine when they come to me, and so it's
Yeah.
an education component, and they're following up with you. But I think most importantly is that they're checking those boxes,
Right.
Yeah.
right? Because these issues are very much linked. And I mean, I think we both recognize that someone that's struggling with trauma is probably not going to be their best selves, regardless of, the functional medicine that we're doing for them. Similarly, I can treat someone's nervous system, but if they're not, you know, doing what they need to for their physical health
Yeah.
and nutrition,
Right.
they're going to fail, right?
Yeah.
And we'll either of us will end up seeing very short-term gains.
Hmm.
And I think, again, back to the general picture of healthcare, in order to make this cohesive, we really need to communicate, right? I
Yeah.
think that's the biggest
Hmm.
aspect that again is missing. I think being able to talk with other doctors is something that we've lost along the way,
Totally.
and having that provider connection is really critical.
So, Dot, how
Yeah,
did you transform to this type of healthcare functional medicine? You have your own story that kind of took you down this route?
I do.
Um,
I do.
no, I don't. But I will
Uh,
tell you, it was my patients. It was them saying that this is, hey, by the way, this is something I'm addressing. And then I looked into it more and started to understand more the physiology.
mhm.
I'm a molecular biology major. I understand that the cells in our body aren't individual. They're all working together,
Mhm.
right? And for my treatments to work, again, there has to be a team approach. There has to be
Yeah.
maintenance of this, and it requires a
Mhm.
lot of providers. And it's not just functional medicine, right? It's their
Mhm.
therapist, it's their primary care. Like
Yeah.
like Dot said, she's not here to replace the primary care. I'm not here to replace the therapist. These specialties are complementing each other. But if they're not open to that communication, then they're just working against each other often,
Exactly.
unfortunately,
No,
right?
so I was saying that
Exactly.
same question to Doc because I didn't get to hear her story. I think everyone would know why she's so passionate about functional medicine because you don't go to the school, be a
No.
PA, and say, "Okay, I'm going to functional medicine." A
No.
lot of times you see functional medicine doctors that just focused all their lives on this. Your
Yeah.
story is different. Do you have your
Yeah.
personal story because of it?
Yeah, I do. It's so funny you asked that because I was like, oh gosh, I hope it gets pretty personal. But it's odd the way it kind of presents. So I went to PA school, and right out the gate went right into emergency medicine, and then later down my career into trauma and acute surgery, right? And even just starting off in the emergency department, this is like 11, 12 years ago, I would be telling people, look into elderberry. And this is when nobody was talking about these things. And it was kind of not hush hush, but not mainstream, and I actually even interviewed with a functional medicine provider, but life took over. I'm a mom and I have my kids, my husband, all that stuff. But now looking back in my journey, I realized I've always been this curious, ask questions type person. And back in my early college years, I was diagnosed with we're going to get real personal. I was diagnosed with a pituitary tumor. So your pituitary is in your brain, right? It's a gland in your brain. And I was diagnosed with this pituitary tumor. I didn't really think much of it. I did everything I was told. It was either have surgery or take medications forever, really. And I was like, okay, I'm scared of surgery. So we're going to do the medication route. And I responded quite well. I shrunk it down very, very well. But how it was explained is that the capsule would always be there unless I had surgery, right? So I shrunk it down to very minuscule amount of medications, and I responded well. Fast forward, guys, I know you're not a woman, but I had abnormal pap smears. Again, didn't think anything of it. Very routine for more, women out there. Didn't think anything of it. And then 2 years in, I was getting kind of frustrated with the whole watch and wait, which is a lot of things in our modern medicine world, watch and wait. And now looking back, that's not what functional medicine is. It's our body telling us something is going wrong, right? I did a lot of my own personal research and kind of did a experiment, if you would, and found a mushroom extract. And I'm not telling people to go take a mushroom extract, but for me, I took a mushroom extract, and my pap smears cleared up, totally negative. And then I was like, okay, great, that's a W, right? And then a year later, not thinking because they were completely separate in my head, right? I had my annual MRI, and it was negative. There was no tumor. And I was like, they messed up my results. There's no way. I was told I was going to have this for the rest of my life. I was like, I'll go get another one. Like there's just no way. And the only thing I can correlate it to is this mushroom extract. And I have to say a million times over, don't go and take a mushroom extract for thinking it's going to cure everything and end all be all. But I'm just telling you this story because it just shows that you don't have to accept the answers that are in front of you, and you can always look deeper. And there's usually your body's telling you something through these symptoms. What is it trying to tell you? These things like tumors and cancer, and these things are very complex, right? And mushrooms will not cure all, but there is more to the story. And I guess that's where I kind of started with, is that I like to ask why, and I will go to the ends with you, and I'll ask why with you.
I love
That's
that.
that. See, and that's why you and Dr. Louwers are innovators in so many ways of what you do in different parts of medicine. Because at the end of the day, everyone is tired of saying, no, we can't fix this.
Yeah.
And there's potentials of making tremendous growth with working with both of you guys.
Yeah.
Yeah.
So,
And patients are tired of,
Yeah.
they're exhausted by, a lot of the traditional
Hmm.
management and
Hmm.
medications and symptom management,
Yeah.
right? I think patients are, are very interested in root cause care.
Yeah.
Last question for you, Dot.
Yeah.
So if I mean, going off of that, obviously, 100%, of course, they shouldn't go off and seek mushroom extract for everything.
Yeah.
But if you did have a couple of practical tips, just, hey, here's some suggestions
Yeah.
for, you're interested in functional medicine. Obviously, we want to know, how do they get a hold of you? But of course, what other tips might you have just to improve their mind body health?
Yeah. I'll say they're not flashy, right? They're not flashy. They're usually the little ones are huge, right? They have big impact. So
Right.
go back to your foundations, your basics. I actually won't even give people supplement recommendations until we've worked through the basic foundations, because You can throw all the vitamin B, D, anything at it. It's not going to do much if you're not sleeping, right?
Right.
It's really not. Your body needs that time to reset. So we work on the basics, right? Looking at your sleep. What does your sleep hygiene look like? Your movement, right? Are you moving throughout the day? Are you getting that sunlight, right? That precious sun. What does it look like for your water intake to, your nutrition? And not only just what you're eating, how you're eating. Are you eating like I used to as these busy moms, like half a chicken nugget on the run chasing your kids? Or are you sitting down and intentionally having that meal, sending your body into that rest and digest so that you're able to absorb and have that better meal for nutrition value? So they're not flashy. And obviously alcohol is a big one we always focus on too. But in looking at your alcohol intake.
Yeah, no, those are great, absolutely practical tips. I love it. Yeah, I mean, it makes sense, of course, right? Sleep better, exercise a little bit every day, eat well, eat the right things at the right times,
Yeah.
all that. Yeah, absolutely. And how do they get a hold of you? What's the best contact or
Yeah.
website for you?
Yeah. My website is a great way to book a free interest phone call with me. You get me for at least 30 minutes, but I'm a talker, so it's usually more.
Ditto.
And, and you can book your free interest call with me at any time. And that's through my website, which is Dot Chmiel. And my Instagram, of course, too, which is DOT, DOTCHMIEL, period PAC. Those are two great ways to get a hold of me. If you just want to go cut right through, you can always honestly, even shoot me a text because some people are weird with the calls, or if you're old school and you like to call too, that's fine. 440-427-4574. But everything's on my website, and it's all right out there for you.
All right.
Awesome. I love it.
Dr. Louwers, where can we find more info on you?
So the resetcenter.com is the best place to go. We're always updating what we do and I'm always pushing education. Um, I'm doing some talks in the upcoming months, first responder convention in October. And we're also starting Spravato now. So we're accepting patients that are interested in Spravato, which is a form of intranasal ketamine to help treatment-resistant depression. It's FDA approved and accepted by most major insurances.
All right.
Very cool.
Fantastic. All right. That was the special simulcast of the Neil Haley Show and the Reset Medical and Wellness Podcast, guys. Take care. Hold on 1 second.